Welcome back. How cool is this? We're taking a look at the fountain located in Gateway Center in downtown Pittsburgh. The water is dyed pink in honor of Breast Cancer Awareness Month, which is all about bringing the disease to so many women that are diagnosed every year into the national spotlight. And Scott Danka took this video with our drone, and how amazing is that? Loving the pink. So right now I am joined with Jennifer Steiman, and we were talking a little bit even before this just about some different types of breast cancer. But first, I want to discuss, October is Breast Cancer Awareness Month, but why is it so important to talk about it all year long?
Yeah, so breast cancer is obviously something that we detect every day. It's nice that we have a dedicated month to make women aware that we need to do this yearly, but it's definitely something that should be done throughout the year.
And then what different types of breast cancer are there?
Yeah, so the main two types are ductal carcinoma, which is when it starts in the ducts or the roadways of the breast, and lobular carcinoma, which is where the milk is produced. We treat those fairly similarly, but there are two different types.
And recently I saw an article about a different type of breast cancer that actually is pretty hard to detect. What is that?
Yeah, that lobular subtype is one that we sometimes don't always appreciate on our standard imaging. We sometimes ask patients to do additional imaging, such as a breast MRI. Those tend to be very sensitive in detecting that type of cancer.
Okay, and screenings, exams, and early detection, it is so crucial.
Yes.
What ages should you start doing this?
So it really depends on risk. So, talking to your family, making sure you understand if there is a family history. Breast density is also something very important. It is state regulated that when you have your mammogram that you are aware of your breast density. The increase in density can certainly increase your risk. So knowing both of those things and talking to your provider about when to start screening. Each society has different recommendations, but in general, we say at age 40 to start that conversation if you're an average risk patient, but definitely starting imaging at 45. If you're a higher risk patient with that increased breast density or that strong family history, start at 40 or younger.
What are the risk factors with this?
Yeah, so there are definitely some non-modifiable risk factors. So when patients begin their menses, when patients go into menopause, how many children you've had, those can be some of the risk factors. It's really exposure to estrogen that can be that strong risk factor.
And then what are some misconceptions that people have about breast cancer?
So a lot of people feel if they're doing their exam and they don't feel anything that they're okay. But really that's the benefit of screening. We want to catch things very early so we can be actionable for them. And so yes, doing self-exams is important to make sure that you know what your normal is, but getting that screening so that things are detected at an early stage is extremely important.
And then screening is so important, exams, all of that, but then you go through that, then what are even some treatments?
So patients who have breast cancer, there are four main types of modalities that we provide to patients. So surgery is a mainstay, and that's what I do as a surgical oncologist. Some people need radiation therapy, some people need chemotherapy and anti-estrogen medication, which is a pill. And each patient, when we see them, we take into consideration the type of cancer they have, their patient preferences. Some patients prefer less surgery, some patients have a high risk of future cancer and need more surgery. So we take into consideration not only the cancer, but their preferences as well.
So being the UPMC surgical oncologist, what kind of services and treatments do you offer even through recovery?
Yeah, so when a patient is seen, they oftentimes start in our office as the surgical oncology office, and then most cancers at that point are treated surgically. Then after we receive the pathology, we then decide which other services they need, and then they go and see those specialists. But throughout that process, we have social workers who help patients navigate that system. We also provide resources to patients, so there are national societies such as the American Cancer Society that has a lot of great resources for patients going through this journey.
And then I know you were talking about how, it starts at age 40 really to do that, but what if you're under the age of 40, what should you do?
That's really where family history comes into play. Mammograms were really designed for patients in their 50s or 60s, and so if you get a mammogram too early, it actually won't be very informative. So if a patient is a high-risk patient, we often combine that with a breast MRI, and we would start that in very high-risk patients such as mutation carriers. That would start at age 25. They would then combine a mammogram and an MRI starting at age 30. But again, that's for the patient who has a very high lifetime risk of breast cancer.
All right, that's very informative. Thank you so much
welcome.
for joining me today.
Thanks.
And for more information about those services with UPMC, you can head to our website.